Welcome to the We Level Up Treatment Center video series. In today's video we will discuss wet brain syndrome. What is wet brain syndrome? Wet brain syndrome, also referred to as Wernicke-Korsakoff Syndrome, is a brain disorder due to vitamin B1 deficiency. This happens all too often among individuals who have an alcohol problem, as alcohol use disorder causes a lack of vitamin B1. In addition, wet brain happens when two different conditions, Wernicke encephalopathy and Korsakoff syndrome, occur concurrently. Both of these problems are due to brain damage caused by a lack of vitamin B1. According to the National Institute of Neurological Disorders and Strike, NINDS, 1. Wet brain may result from alcohol abuse, dietary deficiencies, prolonged vomiting, eating disorders, or the effects of chemotherapy. B1 deficiency causes damage to the brain's thalamus and hypothalamus. Wet brain syndrome symptoms include mental confusion, vision problems, coma, hypothermia, low blood pressure, and lack of muscle coordination, ataxia. Korsakoff syndrome, also called Korsakoff's amnesic syndrome, is a memory disorder that results from vitamin B1 deficiency and is associated with alcoholism. Korsakoff's syndrome damages nerve cells and supporting cells in the brain and spinal cord, as well as the part of the brain involved with memory. Symptoms include amnesia, tremor, coma, disorientation, and vision problems. The disorder's main features are problems in acquiring new information or establishing new memories and retrieving previous memories. Although Wernicke's and Korsakoff's are related disorders, some scientists believe them to be different stages of the same disorder, which is called Wernicke-Korsakoff syndrome. Wernicke's encephalopathy represents the acute phase of the disorder, and Korsakoff's amnesic syndrome represents the disorder progressing to a chronic or long-lasting stage. Symptoms of Wernicke-Korsakoff syndrome. Symptoms of Wernicke encephalopathy include confusion and loss of mental activity can progress to coma and death. Loss of muscle coordination, ataxia, that can cause leg tremors. Vision changes such as abnormal eye movements, back and forth movements called nystagmus, double vision, eyelid drooping. Alcohol withdrawal. Normal mental activity can become harder and harder for the individual to maintain as Wernicke's progresses. It can potentially become so severe, in fact, that it progresses into coma-like states and even death. This is one reason why the early signs of this disorder should not be ignored. Symptoms of Korsakoff syndrome include inability to form new memories. Loss of memory can be severe. Making up stories, confabulation. Seeing or hearing things that are not really there, hallucinations. Like Wernicke's encephalopathy, Korsakoff syndrome can eventually lead to coma and death. As a joint problem, both of the syndromes that make up wet brain are extremely severe and should be dealt with as soon as possible in order for the individual to be able to avoid further, serious effects. Causes of wet brain syndrome. Severe wet brain syndrome is caused by the accumulation of fluid in the brain and, in some cases, irreversible damage to brain cells. Individuals affected by this condition are typically unable to live independently and require long-term care or support. In addition, mobility may become impaired, and individuals may require physical or occupational therapy. Treatment options for severe wet brain syndrome can include medications to reduce symptoms, physical and occupational therapy, speech therapy, and lifestyle modifications. Severe wet brain symptoms. The symptoms of severe wet brain syndrome can vary depending on the severity of the condition. In general, they may include confusion and disorientation, speech and language delays, memory deficits, and increased impulsivity. Difficulty completing tasks, impaired motor coordination, incontinence, difficulties with coordination and balance, tremors, and seizures. The most common symptoms of severe wet brain syndrome include memory loss, impaired cognitive function, difficulty with balance and coordination, confusion, varying levels of mental confusion, impaired motor function, muscle weakness, vision problems, and difficulty speaking. In more severe cases, individuals may experience seizures, coma, or even death. Other symptoms of severe wet brain syndrome may include changes in behavior and personality, severe depression, agitation, and anxiety, increased risk of suicide and self-harming behavior, hallucinations, paranoia, and delusions. It can also cause difficulty with reasoning and problem-solving, as well as poor judgment and decision-making. In addition, people with this condition may have difficulty understanding abstract concepts and difficulty with executive functioning skills. The link between alcohol abuse and the Wernicke-Korsakoff, wet brain. Alcohol abuse is strongly linked to wet brain syndrome, also known as Wernicke-Korsakoff Syndrome, WEAKS. WEAKS is caused by a vitamin B1 deficiency, which is often caused by heavy drinking or starvation. Alcohol impairs the digestive system's ability to properly absorb B1, leading to a deficiency in the vitamin and potentially resulting in the development of wet brain syndrome. Wet brain syndrome is a severe form of thiamine deficiency, which is caused by a lack of the vitamin B1 that helps the body to produce energy. It is most often seen in heavy drinkers and those with an unhealthy diet who do not receive enough of the vital vitamin in their diet. Symptoms of wet brain syndrome can include memory loss, delusions, disorientation, and even extreme changes in emotional state as the brain is not able to properly process incoming information. Wet brain syndrome diagnosis, exams and tests. Examination of the nervous, muscular system may show damage to many nerve systems. Abnormal eye movement. Decreased or abnormal reflexes. Fast pulse, heart rate. Low blood pressure. Low body temperature. Muscle weakness and atrophy. Loss of tissue mass. Problems with walking, gait, and coordination. The person may appear poorly nourished. The following tests are used to check a person's nutrition level. Serum albumin relates to a person's general nutrition. Serum vitamin B1 levels. Transketolase activity in red blood cells, reduced in people with thiamine deficiency. Liver enzymes may be high in people with a history of long-term alcohol abuse. Other conditions that may cause vitamin B1 deficiency include HIV, AIDS, cancers that have spread throughout the body, extreme nausea and vomiting during pregnancy, hyperemesis gravidarum, heart failure, when treated with long-term diuretic therapy, long periods of intravenous, IV, therapy without receiving thiamine supplements, very high thyroid hormone levels, thyrotoxicosis. A brain MRI may show changes in the tissue of the brain. But if Wernicke-Korsakoff syndrome is suspected, treatment should start immediately. Usually, a brain MRI exam is not needed. A person must be sober when demonstrating symptoms to be diagnosed with wet brain. Considering that withdrawal or medical complications associated with alcohol use can mimic symptoms of Wernicke-Korsakoff syndrome. Is Wernicke-Korsakoff syndrome, wet brain, reversible? According to the NCBI, Wernicke encephalopathy is acute and often reversible, while Korsakoff syndrome is chronic and may be irreversible. However, the severity of a person's symptoms, how early a person begins treatment, and the type of treatment they receive can all significantly impact whether a case of Wernicke encephalopathy can be reversed or alleviated. Some people may make a full recovery, although this is rare. Thiamine therapy will offer varying levels of improvement in symptoms after 5-12 days. Early intervention is the best way to increase the body's ability to restore normal function. Wet brain treatment. Early-stage wet brain treatment can limit and even reverse the harmful effects of thiamine deficiency on people suffering from the condition. There are 3 main methods for early-stage treatment, which should all be applied together. Vitamin B1, thiamine supplements. Abstinence from alcohol. Eating a well-balanced and nutritious diet. Part of treating wet brain as a challenge is that abstinence from alcohol is extremely difficult. Becoming sober and permanently giving up alcohol will prevent further brain function loss and nerve damage. During your rehabilitation, the staff from We Level Up Enjoy Treatment Facility will help you identify what caused your addiction and teach you skills that will help you change your behavior patterns and challenge the negative thoughts that led to your addiction. Please, do not try to detox on your own, especially if you show any signs and symptoms of wet brain syndrome. The detox process can be painful and difficult without medical assistance. It's hard enough that you are struggling with wet brain syndrome. If you or someone you know is struggling with this condition, it is important to intervene early. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.